Dr. David Matlock is here, and his wife and patient Veronica is in our audience. Welcome to you both.
Thank you.
Well, the proof of the pudding is they both seem happy and are smiling, so something must have worked.
Well, you know, as a gynecologist, I get asked about this a lot from women because we do age down there, and a lot of this is due to the lack of estrogen because it can not only get, saggy, but it can also get thin. It can also change color. It can also lose laxity.
Well,
so
I'm glad you mentioned
true.
that because you may start off like this, right?
Correct.
And then you may have a couple kids, and you may go to this.
That's
And then, if you have triplets, you may go to this. So I mean, that is
reality.
But here's the thing. The thing is, I think it's important to understand the majority of my patients are from 20s to 40s. So it's not just about women who are aging or postmenopausal. The majority are 20s to 40s. I really don't understand what the whole big fuss is about designer vaginas. Women want these procedures. Women want to look good there. Women want to have the best sexual experience there, period.
And I know,
As long as you know the risk, because there's a lot of controversy if you should be changing something that's already normal and doesn't have a problem for risk.
Yeah, and real quickly, Dr. Matt, could you explain to us what you're doing down there? Because I need to I want to understand
Is it just a tightening thing, or is this an aesthetic outside situation?
This represents the mons pubis and the labia majora. So what we will do primarily is either make a small little incision here in the mons pubis so that we can remove the fat by liposculpting. And normally this will go down into the upper areas of the mons of the labia majora, and we can liposculpture this area as well. That's what they want.
Okay, Dr. Matlock.
with a real fine cannula,
With the
real
very fine
instrument.
3mm cannula.
I hear you, and I'm never going to tell somebody what to do or what not to do with their body. I just would want them to understand risks. Are there risks? What about sensitivity? What's the recovery time on this? What can go wrong?
Because we're not denying it's not plastic surgery. It's not a surgery that women may not want. But you do have to know, just like with any plastic surgery, that there are risks and things and that's what the ACOG has a problem with, is you may be trading more risks for
ACOG?
American College of Obstetrics and Gynecology.
Oh, thank you.
For the risks, versus the benefits, okay?
Yeah. Well, for any procedure, there's risk. But what we did, we looked at a study. We did a study that was published in 2010 in the Journal of Sexual Medicine with over almost 400 procedures in a large multi-center outcome study of female genital plastic surgery. And what we showed as far as satisfaction, 91.6% of those women liked the procedure or were satisfied with the procedure. About 86% of those patients who had vaginoplasty or had a vaginoplasty, they reported, 86% said it enhanced sexual gratification. The risks are less than 1%. Now, if these things weren't safe or they weren't effective, would I do them on my own wife?
I know, and we have
Where is she?
Veronica
There she
down
is.
there. She's so beautiful. We know how he feels about the surgery. I want to know how you feel about it.
The surgery is absolutely fabulous. It completely changed my life. After I had the surgery, I feel so much more confident. I feel so happy, and the sexual benefits are absolutely fabulous.
I concur.
So if you don't want to do it,
But we have to ask, where do we, as plastic surgeons, draw the line?
If a husband, a significant other, or partner is pushing the patient to do it, don't do it. I want the woman to come in under her own volition and request these procedures.
So
Same
in the
with
end,
you.
Exactly.
know the risks that go along with any procedure. Dr. Matlock, thank you so much. Veronica, thanks for joining us today.